Good afternoon, everyone, and welcome to today's webinar, Streamline Your Revenue Cycle with Workflow Automation, presented by Matt Seefeld.
So I appreciate everyone joining today. We will spend a little bit of time talking about workflow and, more importantly, using artificial intelligence and machine learning to drive more automation in revenue cycle. It's definitely something that we've had to use here at MedEvolve within our own services department, and we're excited to share some of our ideas with you. Just background on MedEvolve, company's been around for 20 years. We are privately held, 100% self-funded. We serve over 600 physician groups, lots of providers, and most of the states. We are headquartered in Little Rock. Most of our employees are out of there. I actually am located in San Diego. Humidity is not as bad today as some of the areas in the country. That's a joke. And then we have folks in and out of other states as well. But the bolus of us are in Little Rock, Arkansas. Just background on me, I've been in the industry for over 18 years. I've only focused in rev cycle, mainly focused in academic medical centers, health systems, physician group practices, doing mainly workflow automation, consulting, and analytics. And so that's my background. I guess real quickly, just what I do here, I do run all of our business development, and I am over all of our RCM operations or rev cycle operations in Little Rock, as well as our data science analytics team. So what are we going to talk about today? So a few things. One, we'll talk about a little bit of an introduction to what AI-driven workflow means, other than a lot of big words. We'll talk about why it works and why the industry continues to adopt this methodology. We'll talk about what it can do for you and your organization. We'll talk a little bit about what it's done for us and our organization. And then we'll get into some nuts and bolts, and we'll summarize it and leave some time at the end for questions. So, introduction to workflow. So what is it? When you think of the revenue cycle today, we have tons of challenges that go on, mainly because a lot of manual processes still exist. We have to rely on humans to make critical decisions, everything from really the scheduling all the way through the pre-registration, the point of service in the waiting room, to the actual delivery of the service, to the coding, to the charge entry, to the billing, to the AR follow-up, to the self-pay statements, to the claim adjudication, to zero balance. So just a few things, and a lot of people and a lot of process tied up in that, and a lot of technology. And so one of the things when we look at the back end of the revenue cycle, which is our focus today, which is really from the time that claim gets submitted to the insurance company, making sure that you're able to effectively get paid what you're supposed to get paid, and timely, and also drive accountability in your business office with the staff is really important. So complexity is not going to change, but leveraging technology to improve workflow automation is changing, and it's something that's being adopted in the healthcare marketplace, and many of you have probably already started to do that, or you plan to do that. When we look at AI, everyone, it's the buzzword of the day, right? AI, machine learning. It's the same thing big data was a decade ago. Everyone wanted to talk about it. We hear about blockchain, et cetera. Yeah. I look at this is one, it's a huge industry. It's been used for many, many years, many decades in non-healthcare industries. And we're starting to really see it on the clinical side in healthcare, but we're also seeing it on the financial operations side. And really what we're trying to do is take all of that data and information that you're currently getting and storing somewhere in a database or warehouse, and actually putting that data to work in a very structured way. And you can put that to work in analytics. We did a transparency analytics webinar a few weeks ago, and you can put that to work in workflow as well. So working smarter, not harder, letting technology do more of the heavy lifting, so that your staff are working exactly what they're supposed to be doing, and they're working the right way. I always like to use us as a case study. We had a big business challenge about 18 months ago. Our margins were getting thinner and thinner in our revenue cycle department, right? Insurance dollars are getting less, patient dollars are getting more. And so we're under pressure to make money to sustain any sort of margin in our revenue cycle business. And so we actually had to look at a material reduction in hard FTE costs. We had to reduce somewhere around 30–35%. And it turns out we've actually done more than that. We're well over 40% as of this month since we really began this initiative. And what we did was we took all of this more manual work that used to be done in work lists and spreadsheets, and, dividing staff in 8 different ways and trying to figure out how to prioritize workflow and AR follow-up. And we brought automation to it. We built a cloud-based workflow management system driven by AI that allowed us to work a lot smarter scale faster and do and cover our clients with less people, and that's been material. What we've then started doing is actually rolling our system out to a lot of our large practice management clients, right? The ones who will always keep the revenue cycle, but they needed more transparency and they needed more automation in their businesses. So it started with us. It works, and we're excited to share some of the methodology with you all today. So machine learning, AI, right? Working smarter, not harder. These are things that are pretty relevant in healthcare, right? We're trying to reduce cost to collect, right? That's the goal, right? Because the margins are going to get thinner. I don't think the 2020 elections are going to solve the cost problem with healthcare. So your supply costs, your variable costs, your fixed costs are still going to be going up. Yet your reimbursement from the insurance company is going down, and more of that dollar shifting to the consumer, which we all know they don't necessarily like to pay what they owe all the time. In some cases, never. So you have a lot of pressure on your P&L without realizing it. So when I think of automation, one of the things we want to do is we want to know what the complete accounting of our AR is, right? And I'm going to go through some questions here in a second that I had that I couldn't answer a year and a half ago that I certainly can answer today, right? We need to understand where the claims are that aren't paid. We need to know it real time. We need to make sure that they're actually assigned somewhere. They have a home and there's an accountability resource associated with those. We also need to make sure that people are working what they need to be working. Right? They're taking action on claims that actually have to take action. We're going to talk about the amount of claims that really get carved out because there's no action required today. That doesn't mean it's not going to require action tomorrow, but today they don't need action. So why would you be overstaffed to handle those claims that there's nothing you can do about moving that ball down the line, right? It's already in process. Transparency, you guys heard a lot from MedEvolve the last year and a half. Most of our R&D is going to workflow automation and transparency solutions, right? Analytics around workflow, analytics around revenue cycles, speed to data, speed to insights. These are the buzzwords that we're using because we have to run a business, and our clients are demanding that we run a business this way. And so when I think of automation in the back office of revenue cycle, if you don't know what your folks are doing every minute of every day, and more importantly, the outcomes they're generating on the actions they're taking, you have a problem. That is something you have to look at. You also don't have time to manually cut work lists or think about every morning, well, geez, what should I queue up today for them to work, right? You don't have those minutes anymore. Maybe 5 years ago it worked, but today it's not going to work. And tomorrow it's certainly not going to work. Quality reviews, how long does it take you to assess performance? You should be able to do those in minutes, not days. Or in some cases, when I talk to some of our clients before workflow and automation, it's like, well, I just can't get to it. It's too hard to pull the accounts, and then I got to read all the notes, and then I got to assess what actions they took and whether it worked. That's got to be minutes. It cannot be a arduous process. So let's talk about why it works, right? 4 benefits of getting out of the spreadsheet world, as I like to say, and into more of a data-driven approach. So really the first one, I kind of look at it this way is, what is life without workflow? And this is really, and I've talked to so many of our clients before we install our workflow system. So tell me about your workday. Usually it starts with, well, the billing manager gets in, looks at an ATB, starts to strategize on the day. Like, well, it looks like commercial bucket in the 120 plus is going up a little bit. Blue Cross seems to be stable. Medicare, not so good. Okay, so I'm going to put you on this, you on that. Here's the work list, and go for it. Sometimes that's done at the beginning of a week. It's like, I'm going to cut your work list out of Excel. I'm going to give them to the staff, and I'm going to say, hey, get through as many of these as you can. And then I'll run another one next week. You can't do that anymore, right? This stuff has to be queued up. You can't allow the staff to guess how to prioritize their work, right? They don't want to do that. They want to come in the morning, they want to hit start, and they want to go. And believe it or not, a lot of them want to actually see their effectiveness and how well they're doing. I mean, if anyone's working an 8-hour day, a lot of the human nature there is that they want to know that they're going to be recognized for the hard work that they do and the results they achieve. And we actually, personally at MedEvolve, we put in a large financial incentive for our whole RCM teams to hit their benchmarks, and real money getting distributed every month to people that are delivering. And that's something to consider, but you got to have ways to measure that in order to put that in and make it sustainable. So with workflow automation, your staff gets in the morning and they log into their system, and guess what? They hit start. And the first claim in front of them is the claim that you want them to work because their intervention is required to get that claim paid. right? And it let it rely on, it relies on machine learning. It's bringing data from your EDI clearinghouse. It's bringing data from a lot of different systems, but let the sophistication of the technology and the algorithms run that work for you, okay? Staff productivity increases. It's amazing in my career, once somebody knows they're being watched and you have real, consistent, objective, non-emotional data being delivered to them every week, all of a sudden productivity increases. Once people realize quality is being checked, all of a sudden quality increases. People start asking for help. They start asking for more training. Could you send me to a class to learn more about commercial managed care billing, or could you teach me more about coding? So these things will gravitate. And frankly, for the staff that won't elevate their game, you probably don't need them in the long run because they're just costing you money. And that's what we found at MedEvolve was there were some people who just didn't want to buy into the new process and the new methodology, and that was okay. We weren't forcing anyone to stay here. But visibility is key. I think it does pave the way for performance incentives. I think that you can provide financial incentives, whether money at the end of the month. It could also be pizza parties, potlucks. Our team in Arkansas loves their potlucks, so we make sure that we do those types of things as well. And then, like I said, for the low performers, the people that aren't going to get on the pathway to the new world of expectation, then that's okay. You can exit and you can backfill those positions with people that want to be there. I was talking with a client this morning, and the CEO asked me a question, which was great. He's like, "Oh, this is all good. It looks awesome. We definitely want it, but I'm going to get asked by the doctors, where's the ROI when you start looking at workflow automation?" Well, there's really a few components to ROI. The first one is you do have the ability, once you carve out all the things that they don't need to look at, there is a potential that you could reduce headcount. However, you could also repurpose folks. So in this scenario, I said, you have a big issue with insurance verification, COB eligibility, authorization denials. Why don't you repurpose some folks upstream of the revenue cycle and get them to do more financial clearance activities? So you can look at repurposing folks to other areas of the revenue cycle to improve your financial performance. I think the other big thing is for those of you that do carry some excess insurance AR sitting out there, or self-pay AR sitting out there, with the right focus on those denials, you will see AR come down, which will convert into cash flow, right? It will increase, balance sheet improvement for the finance folks on this call. You will also see behavior changes up front because you're going to have real data now to really go back and say, hey, look at all these denials we're having to work to overturn that could have been fixed if you had done the right thing at the right time up front. So you will actually see a P&L improvement, right? And net revenue, your GCR, your gross collection rate should go up. Your NCR should go up. So those are some of the intrinsic values of using automation and AI-driven workflow automation to run the back end of your revenue cycle. Obviously, administrative costs are there as well as a fourth benefit. And when I think about that is, I've talked with clients and it's, well, I spend 5 hours a week cutting work lists, and then I get them in Excel, then I send them to the team, and then at the end of the week, they send it back to me, and I look at the notes. All of a sudden, that's hours of administrative stuff that you need. Install a workflow system that does that work for you. So I think that, the administrators are more effective, the managers are more effective, the supervisors, the leads, and the staff are more effective. So what can workflow automation do for me? So this is crazy. We've installed this. We've been using our own internal one since October. We started to roll it out to some of our larger practice management clients in January. And I've yet to see go live where 80 to 90% of those outstanding insurance claims don't actually have to have intervention today. I know that seems crazy. I'm going to show you some numbers here in a second to further explain that. So the question is, why is your staff working them? Right? There's nothing that can be done today by the staff to get that ball further down the line towards the goal line. Why look at them today? Now, tomorrow, something may happen, right? It could be a denial. You could get a call back from insurance, or something like that you do have to look at it. But if you don't have to look at it, don't look at it, So I think that's really the first piece there. Protecting the AR is another thing, right? Once you carve out the things that don't need to be looked at, you actually have a lot of time now to focus on the things that do. And that's where you can really prevent your timely filing write-offs. You can prevent all your appeal statutes. You can make sure that you're turning AR faster, reducing days in AR. So there's a lot of things that you can do because you know that you're looking at things today that actually have to have some form of work to get paid, okay? Productivity is another big piece as well, right? that the folks that are working claims that have to be looked at. They're not just punching buttons. You know, we were in a situation where we had folks who like to go in and pull correspondence, and they would just quickly go through any piece of correspondence that was just an FYI, like there was no intervention or action required, just to get credit for the work. Well, that changed once we started looking at effectiveness, which I'll talk about here in a second. These were the questions that I asked. I'm going to move through this pretty quickly. I could not get the answers in April of 2018 to any of these. Today, I have those answers real time. Okay. So, you know, you can kind of read through those, but, you know, the biggest one for me is a complete accounting of my AR. I needed to know the status of every claim on my AR. I needed to know how my staff was performing. I needed to make sure that a claim was assigned to a person and assigned to a work list. And if there was claims falling into what I call unassigned or the black hole, I could find those claims in a second, not a minute, but a second. And I knew the risk of those claims, and then I could research why they weren't in the work list. So these are the questions that you have to have answers to. We did have a nice case study done, an interview with John Parisi out at Neurosurgeons of New Jersey of the results that he started to see. He was our first non-MedEvolve client. The MedEvolve RCM client that went live. So it's been great working with them. And then we've got a lot of other clients we've been working with that are starting to see similar results. So more case studies coming down the road there. In terms of, I just want to show you what I mean by this is what I call your carve outs. Is you look at that top section there, right? It's almost 20,000 claims on active AR for this client for about 4.3 million in AR balance. We actually have an algorithm that estimates the liquidity of that AR balance, which we call cash opportunity. So if they collect what they should collect on that 4.3, they'd get a little over 2 million back in cash flow. But look at the 80% that fell into the system list. That is the science behind workflow automation. Is you have to be able to carve out the things that don't need to be looked at today, because if an average FTE can manage 1,000 claims, you would be staffing this business office with 15 people. Well, the only thing that they have to look at is those 4,000. So now you're staffing that business office with 4. So what are you going to do with the savings of not having to hire more folks or repurposing people that you have to other areas of the revenue cycle, right? It starts to become material. Load balancing is another thing. I kept asking my supervisors, how do I know so-and-so has enough claims to work? Well, we don't really know. Well, now I do know. I know the claims that are assigned to each representative. I know the balance. I know the value of that AR. I know how far through their work lists are. You know, I know the percent work. I know the average age of the claims they're working. I know how far they're pushing the claims out. Right? We know this stuff now, and any business office has to have these tools. This day and age, it's too important not to have these tools. Standardization, you know, I think in the olden days it was, well, I type my notes in the memo field and then I went to the next account. That's great, but unfortunately a memo is not reportable. Okay, so again, make them select activity codes, make them select the status code, make them select the action they take based on the status, right? That's now reportable. So when somebody asks you, the physician says, hey, what's the status of my AR? It's like, well, hold on, Dr. Smith, let me tell you exactly what the status of your AR, and more importantly, let me tell you the action I've taken off of those statuses. That's a powerful conversation to have. Any workflow system, AI-driven automation, you want to limit the amount of time you spend in the native system. So for us at MedEvolve, we've brought most of the tasks that you'd have to do in the PM into the cloud, right? So you view EOB, viewing claim statuses, correcting, refiling claims, changing insurance, et cetera, et cetera. Those things have to be done in the cloud, and they have to have immediate integration back into the PM, because you don't want folks to have to work with two systems, right? It can be done. It's been done for many, many years in my experience. But again, the more efficient you can be in the cloud, the better cost to collect reduction you're going to see. And then productivity, right? These last two slides are really around productivity. You know, how are my staff doing week to week? How do they compare to the average? How do they compare to the group, right? Do I need to start having performance discussions, you know, and so forth? So you've got to have this stuff real time at your fingertips. Status codes of the AR we talked about, right? I don't want to just know what you did last week. I want to know what you actually, literally, physically, what you did last week. You know, if you worked 71 claims, what was the statuses? What was the actions you took? Okay. The last but not least here, when are my collectors working? If you don't know this, you got to know it, all right? It's hour of day of week. You can't, if people are taking off time in the morning, if they're cutting out early in the afternoon, that's costing your business office money. You need to have that transparency. How effective are your collectors, right? Just because they work a claim doesn't mean it's going to generate a positive financial outcome. So who's generating the most positive financial outcomes? How many actions does it take, and that far right there, to generate that outcome? Why is some people take 2.3 times and some people are doing 1.5? What do they do differently? Can you train, cross-train, educate, right? So again, you got to have the outcome, not just the productivity tracking, you got to have the outcome tracking as well. So in summary, we know rev cycle is not getting less complex. We know that the pressure on insurance money is only going to get worse. We know that the increasing patient liability is only going to get worse, and it's still hard to collect. Even though I think there's some progress being made in that arena, it's still hard to collect. You have to have workflow and, more importantly, automation in those workflows that removes a lot of the thinking involved with what I need to work today. And I think that would be my one takeaway for everybody on this call is that get in, the work is delivered right in front of you, you know what you need to do, and get after it, and make sure that with the analytics that you're getting the outcomes you expect from your folks. Other areas to consider, here at MedEvolve, we've built out our patient balances. So that's something that we're rolling out now is the ability to work the self-pay claims, just like the insurance claims. I think you got to look at coding, right? AI-driven workflows for your coding. I think you have to be able to work your billing and clearinghouse edits. We do have that capability today at MedEvolve. And then one of the things we're building out right now is our whole pre-registration financial clearance. We talked about AR today, but let's not forget about the more important thing, no offense to the AR side, is the front end, right? Because you do it right up front, AR starts to become easier and easier and easier. So did I verify benefits and eligibility? Did I verify COB? Did I get an auth in place if it's required? Did I estimate a patient liability? Did I collect that patient liability at or prior to service? Did I verify demographics so I don't get return mail, et cetera, et cetera? So all of those functions are critical too. And again, use workflow and AI-driven automation to make sure that those schedulers, pre-reg folks, check-in folks, check-out folks have the tools necessary to be the most effective they can. So lots more areas around revenue cycle. I'm going to stop because I want to be sensitive to the time, and I think there might be a few questions from you all. So again, I appreciate the 20 minutes or so, and obviously we're available after the fact if there's more follow-up that needs to be done one-on-one. All right, Ashley, I'll hand it back to you.
Thanks, Matt. There were just a couple questions, and I wanted to mention also that there are 2 handouts that are available to you. They're articles, both about workflow automation, and they're should be to the right of your screen. But anyways, one of the questions is, does this solution integrate with the practice management software, and do the notes cross over?
I think that, depending on what direction you go, and there's lots of workflow management solutions out there. I think some, like in our world, yes, if you're on the MedEvolve system, it is a complete integration, but we are also putting this on non-MedEvolve systems as well. We just recently did GE. We're working on a couple of other PMs, starting to talk about with clients on Epic and eClinicalWorks and such. So, you may not get as much bi-directional integration work outside of native PM, but that is important. I think notes at a minimum does have to be crossover, because you don't want staff to have to do any sort of duplicate entry on the notes piece. You want to keep the business office efficient, and so I think I would put that as definitely a requirement. Okay, great. And there was a follow-up question to that one. Can you connect to multiple PM systems? Yeah, absolutely. And I think that this day and age, depending on the size of the organization, you may have 4 or 5 PMs, or maybe you're acquiring new practices. We have a client today that's actually in acquisition mode, so they're acquiring many practices, many of which are not on the same PM. And so what we're doing is we're taking all those data from those different disparate systems, we're normalizing it, and we're putting it in a warehouse that we will then run workflow off of. So they'll still have one view in the business office, but it'll be 5 PMs or 6 or 7 or 8, 9, 10 PMs behind the scenes. So it's important to have that level of scale. Great. I know we're coming up on our time here, but I'll just pick one more here. Can you refile claims out of workflow? Again, in our world, if you're on MedEvolve, absolutely, you can correct the claim, you can refile it right there, print, as well. So that is something that we went ahead and built in. Again, I didn't want folks to have to log into the EDI. I wanted to limit my people having to log into different systems to do that. I think that if you're looking at a bolt-on to a non-MedEvolve PM, that would require some work from that PM vendor to do it, or from the clearinghouse, but it may be worthwhile depending on your level of relationship, and they're willing to work with you on that. Here's what I'll say to just integration is, could this work as just a true bolt-on where you're just carving out workflow and that's it, no write back? Absolutely, right? I've been doing that for 20 years, especially in the consulting world. It can work. The more integration you can have, though, the more satisfaction you're going to get out of the gate with your AR staff, because if you minimize the amount of time they have to go back into a native PM or any system for that fact, right, to pull an EOB or to refile a claim, it's just a happier life, right? I'm more efficient. I can do it right there on one screen. I don't have to have two monitors, et cetera. So I would always work towards that aspiration. It's not always achievable, but it's a good goal to have.
Great. I think if there's any additional questions, we can, of course, cover them via email. So feel free to email us. And then I think that's probably it for today.
All right. Well, again, super appreciate all your time. If you didn't catch our webinar a while back on analytics and transparency, certainly reach out. We can get a copy of that presentation to you. And we're going to continue to do webinars throughout the year. So we'll look forward to talking with you again.
Thank you.